Okay, that's fine. We're having today's lectures um, on a research models. Bear with me so I could quickly look into downloads. So it's just a lectures. So let's see. All right. What's up? Look at that. So, yeah, there we have. It's happening. Um, and see something. Let me stop this. All right, then we just have to crack on. So basically, what we intend to have today is to look into what we call your research in health and social care. One that you might be able to complete a research project in health and social care. Okay. And we've had lesson one and lesson two. And today seems to cover lesson three, which has to do more understanding the processes involved in completing of a research project. Um, Research project consists of areas that students should be able to analyze and find out how to collect data and how to interpret those data that they've collected, and to be able to also explain what may be the stumbling blocks, what may be the um, limitations that students tend to have, or in gathering those informations, what were the, so to speak, the limitations that the person had to go through in collecting all those data. And then you have to look into were there any ethical considerations in collecting of your data, and then what were the existing situation that you found. Every research should be able to solve a problem. Research works are done or are enacted to solve problems or existing problems that surround itself in a particular country or organizations, or problems confronting humanity, and so on and so forth. And so we do research to find out what may be the problems that may be occurring. And then what you seek to do is to find out possible solutions in solving those problems. In doing that, you have to find out what may be those problems, those issues. Have they been thoroughly dealt with by previous write-ups or authors or previous people who have done research on that particular issue? And then you find out if there are any loopholes or any aspect of those problems that have not been addressed. you then do what we call a literature review. Okay, so you are coming up with a new research, but you might need to find out that has anybody written in that area. So an example, you want to find out what may be the causative reasons why there is huge alarm or increase in Boko Haram in Nigeria. Stephen, are you there? Okay. Stephen, can you hear me? Stephen, can you hear me, please? So, for instance, we want to look into what may be the possible reasons why Boko Haram has increased in Nigeria. And so you might need to find out you may have you may have somebody who have written about the causes of Boko Haram, but then probably there may be other parts of those divisions or those aspects of Boko Haram that has not been explored. And so what you seek to do is to do a critique, an overhaul of what has been written, and then you do a review. So literature review is a review or overview of a previously published works on a topic. Okay? A previously published work on a topic. And so you're doing an overhaul, finding out what may be the limitations in that project, and then you critique it so you come up with your own research work. Okay. Are we together? Ola, are we together? So a literature review is a piece of academic writing demonstrating knowledge and understanding, Stephen, you are back, and understanding of academic literature on a specific topic placed in context. A literature review also includes a critical evaluation of the material. This is why it is called a literature review rather than a literature report. It is a process of reviewing the literature as well as a form of writing. Okay? It is a process of reviewing the literature as well as a form of writing. Okay? And so we have to come out with possible outcomes, okay, of that particular review. And so what has been written and published already about a particular topic, you are trying to digress, you are trying to argue your presentation in a different light altogether. Okay. Okay. Now, what is sample data? A data analysis sampling practice of analyzing a subject of all data in order to uncover the meaningful information in the larger data set. Okay. A data analysis sampling is a practice of analyzing a subset of all data in order to uncover the meaningful information in a larger data set. Okay, so having established your literature review and your argument that you seek to explore and present to your supervisor, you then do what we call data sampling. In other words, you have to collect data, okay, because you've presented a review of the direction or the focus you want to go, and therefore you need to collect a data relevant to the direction you want to go. Okay, so you have to develop a research terms. When you say search terms, what kind of area are you looking at? So your search terms may be probably you are looking at younger kids between 12 and 17 years or adolescents within that age. That defines your search terms. What are the behavior patterns of adolescents in those age? You want to limit yourself to those search terms, okay? And then search using terminologies, and operators filters. So you try to narrow your research work to a bit more filters that sort of seeks to narrow you so you don't have a broader research terms. Okay, so you say behavior patterns or traits among adolescents, maybe the age of between 12 and 15 years. And so you limit yourself, okay? And then you have to identify initial primary source, and then you do what we call secondary primary source, and so on and so forth, okay? Now, in reviewing the literature, it is a research activity all in itself, and a contribution can be made to knowledge on a particular subject to the literature review. Literature review undertaken as part of a thesis invariably focus on topic that relate to the main research questions and that have been raised and highlight the influence consumption. A literature review demonstrates knowledge about the extant literature of that field, but it is more than simply describing other authors' perspective and is expected to include a critical evaluation of those. A good review, furthermore, gives a novel synthesis of existing work, which may lead to new ways of looking at subjects or identify gaps within. Okay, so you find out the loopholes, you find out the gaps, and then you critique it. That becomes your project work or your thesis proposal. Okay. Literature review process involves identifying gaps prior to studies with a view to locating one investigation on a broader context. Silverman identifies the context of a literature review as 1. What do we already know about the topic? What do you have to say critically about what is already known? Has anyone else ever done anything exactly the same what is proposed? Has anyone else done anything that is related? Where does your work fit in with what has gone before? Why is your research worth doing in the light of what has been done? Okay, what is irrelevant? What is so special about your research work? Because others have done it already. But what loopholes, what critique, what are you bringing to the table newly from what is in existence? All right, and that's what we call a literature review. Okay, now let's look at data sampling. Data sampling is a statistical analysis technique used to select, manipulate, and analyze a representative subset of data points to identify patterns and trends in the larger data set being examined. It enables data scientists, predictive modelers, and other data analysts to work with a small, manageable amount of data about a statistical population to build and run analytical models more quickly while still producing accurate findings. Advantages and challenges of data sampling. Sampling can be particularly useful when data sets are too large to efficiently analyze in full. For example, in a big data analytics applications or surveys, identifying and analyzing a representative sample is more efficient and cost-effective than surveying the entirety of data or population. An important consideration, though, is the size of the required data sample and the possibility of introducing a sampling error. In some cases, a small sample can reveal the most important information about a data set. In others, usually using a larger sample can increase the likelihood of accurately representing the data as whole, even though the increased size of the sample may impede. So what it means generally is that sampling is quite useful. It is. Okay, because you have to do what we call random sampling. You can't interview everyone relative to the kind of data you want. So you do data sampling. It could be a random sampling, or it could be a survey. Okay. However, there are errors when it comes to sampling. Okay. And this comes about as a result of how huge the sample size is. And when you say sample size, if you are dealing with 100, you want to interview 100 people, it is very huge to do. So you might find yourself depicting some errors and all that, which may be dangerous or that may affect your data collection. Okay, and that's the meaning of data sampling. And so you have to be able to analyze in full. If it is too large, it is difficult for you to manage or analyze if it's too large. Okay. An important consideration, though, is the size of the required data sample and the possibility of introducing a sampling error. In some cases, a sample error can reveal the most important information about data sets. That's very important. Okay? Very, very important. And so, where data sampling is analysis technique used to select, manipulate, and analyze a representative subset of data points to identify patterns and trends in the larger data set being examined. It enables data scientists, predictive modelers, and other data analysts to work with a small, manageable amount of data about a statistical population to build and run analytical models more quickly while still producing accurate findings. Okay? While still producing accurate findings. So this is what it's about when it comes to data sampling. You should be able to create data sample from your findings. Okay? And then what are the types of findings? Okay, we have simple random sampling, which I mentioned. We have stratified sampling. We have the cluster sampling, the multi-stage sampling, and the systematic sampling. Sampling can also be based on non-profitability, an approach in which a data sample is determined and extracted based on the judgment of the analyst. As inclusion is determined by the analyst, it can be more difficult to extrapolate whether the sample accurately represents the larger population than when probability sampling is used. Okay, I repeat that. It is difficult for more to extrapolate whether the sample accurately represents the larger population than when probability sample is used. Sampling can be based on what? A non-probability. Okay, and so I mentioned that you do sampling based on likely probability because you cannot tell the right, but you do based on, so you do random sampling, okay, where data is determined and you extrapolate based on the judgment of the analyst. So in sampling, it's random. Is the analyst who determines, so you sample something and then you sort of pass a judgment based on the sample that you have collected. Okay, so you do what we call extrapolate. You know, you is not exact, but it is perceived to be a probability of something that is likely to occur. Okay, that's the meaning of sampling. So we have convenience sampling. Data is collected from an easily accessible and available group. That's what we call convenience sampling. Then you have consecutive sampling. Data is collected from every subject that meets the criteria until the predetermined sample is met. Purposive or judgment sampling. The researcher selects the data to sample based on predefined criteria. And then quarter sampling, we have the research ensures equal representation. There should be equal representation shared across for all subgroups or data sets. Okay. What then is data sampling? Data analysis is when the process of collecting, modeling, and analyzing data to extract insights that support decision making. There are several methods and techniques to perform analysis depending on the industry and the aim of the investigation. All these various methods are largely based on two core areas, quantitative and qualitative. What is quantitative? What are the difference? Anything that you hear that says quantitative, it means you have to quantify them. Okay. So number one, number two, number three. Where quantitative find out what are the quality, what did they say? The people that you quantify them, what was their response? What were their concerns? Okay. So in quantitative, we say the number of people that we interviewed. In qualitative, we want to display the experiences. Okay. The experiences. All right. Then informed decision making. From a management perspective, you can benefit from analyzing your data as it helps you make decisions based on facts and not simple intuition. For instance, you can understand where to invest your capital, detect growth opportunities, predict your incomes, or tackle uncommon situations before they become problems. Reduce costs. Another great benefit to reduce costs is with the help of advanced technology such as predictive analytics. Businesses can spot improvement opportunities, trends, and patterns in their data and plan their strategies accordingly. All right. Customers are arguably the most crucial element in the business. By using what we call the 360 analytics, vision of all aspects related to customers, you can understand what channel is so they use to communicate with you, their demographics, interests, habits, and purchasing behaviors, and more. So 360 analytics is where you are able to tell how customers vision things, what goes into their thinking, how their habits are, their purchasing power, purchasing behavior. It tells you all those. It's another technique in using. Okay. In the long run, it drives success to your marketing strategies, allows you to identify new potential customers and avoid wasting resources on targeting the wrong people or sending the wrong message. Very, very important. Okay. Very, very, very important. Okay. Data analytics. Okay. Or data analysts. This is what they do. All right. Okay. The analysis process contains 5 key thematic areas. 1, identify. Before you get your hands dirty, you have to identify, isn't it? 2, you have to collect. You have to collect all the needed data. 3, you have to clean. You have to dress it. You have identified, you have to collect it, and then you have to dress it. Okay, you have to dress it. You have to dress it. And then 4, you have to interpret. You have to interpret. Okay? 4, you have to interpret. So 1, we have to collect, identify, okay, get your hands dirty, what we call primary data collection, get everything haphazardly. And then 2, you have to then collect those from the dirty, from all the primary information, then collect what you need. Then having collect, you have to dress it, okay? You need to do a literature review, you need to dress it. Then analyze, you have to analyze pros and cons, argue your weight, okay? All right? And then finally, you have to do interpret. You need to interpret. Where interpret, well, it's important that you interpret. You have to draw conclusions, okay? So there are different ways of presenting and communicating information, and they are. 1, you can use a bar chart, or you can use what we call the pie charts, or you can do what we call histograms, okay? Bar chart, pie chart, and histograms. These are all stuff that you can use, okay? Bar chart, and histograms, okay? Do we have any question? Any questions at all? Any questions at all? Any questions at all?
Hello.
Yes, please.
Yeah, my question, is this more like a general, like a full research proposal?
Yes, you do have to do a full research proposal. Yes.
Okay.
So this is just the literature review aspect of it and data presentations. That's a research work. Yes, you'll be doing a research work. And so this is how, yeah.
Yeah. I was just looking like the time frame, of doing all this within the 2, 3 months that we have for this whole.
Have you done learning outcome 1 and 2 already?
No.
You've not done LO1, LO2.
You mean the assignment?
No, no, no. This lectures.
No. No.
You've not done research um in health and social care in lesson 1, lesson 2. Is it your first time?
Yeah, this is my first time.
Yeah, so you need to do other one. So you need to find out from the office, okay?
Okay.
There should be other lessons, should be about 4 lessons in all or 3 lessons in all before the assignment. But this is basically on the research in health and social care. So meanwhile, you need to do a research proposals, and then you need to submit a research work. That's what it means. Okay, but you cannot do that when you've not completed all your lecture. So you need to have all your full lectures, 1, 2, 3, and before you could start looking into your research work. Okay,
It's okay.
so we have bar charts, we have pie chart, we have histogram, we even have what we call scattered plotting. Okay, scattered plotting or scattered. So there are different ways of presenting data.
Mm.
You can decide to use a pie chart if you have the number of people and then you've likened them to 100%. Then you can do histogram if you want to show more of a graph. You can even do Venn diagrams to show your data presentation or interpretation. Okay, so that somebody picks up your research work, they can tell
Mm.
by what we call your data informations, how many people you have interviewed, how many people will say that, how many people say yes, how many people said no, how many people were neutral. You can present all that. Okay.
Yeah.
Okay. Then you need to draw conclusions, and then also you should be able to do what we call um recommendation and conclusions. Okay.
Mhm.
Recommendations and conclusion.
Hello.
Hello, Steven.
Yeah, please. I think the similar thing happens to me because I joined this month. I think I joined late last month, and this is December, so it means we've missed a lot of lectures. And when I wanted to join, I told them that I think is it a fresher or is it a fresh one? And I was told yes. I don't know why we're on research and methodology now. Actually, I've attended a lecture before, but
Oh, you have
I'm just
already, Steven.
yeah, I've attended one lecture. I'm writing something on just unit one. So I
Oh,
don't know why we
amazing.
jump from unit one to unit five now. So it means they've completed unit one, unit two, unit three, unit four courses lectures and jumping to unit five. Whereas we don't have much knowledge of. Despite that, we've been working in healthcare for long. At least I've been working in healthcare for long, but at least paying for this, we're supposed to have some lectures
That's
to give
true.
us much more insight. It's not like we don't have any. I've done masters in this country. I've done degree. Well, I have a lot of experience, but coming to this one, paying for it at least, there should be a proper lecturing for everyone, like from unit one, unit two, unit three, unit four, before we get to unit five. Which I thought I think the course was about is about 6 or 5 months. Do you get what I mean?
Yes. And good.
So
What
now
I
we are in
understood,
unit five, which means we have missed one, two, three, four.
sometimes it's not the case. Sometimes the office does that, not really to say that they jump in, but they have different lectures for different units. So we need to check. Yes, sometimes not jumping.
Okay, did they just set up lectures based on weekly activity, or they just pick lectures from unit one to five for us to attend it every weekend, or what?
Yes, yes. So we need to check because you might need to have other lectures with other
Exactly.
lecturers.
That's what
Yes, and
that's what
and
I'm
so
saying. It's not I don't even I have a lot of experience about this. I've done a lot of I've attended a lot of lectures, a lot of trainings. But at least paying for this, at least we should have more. Although not every weekend I'll be around. Probably in a month I might be around twice in a month.
yes, yes. I
So
know there are lectures almost every weekend and some during the weekdays, depending on the students' availability and different
you know what I
lectures.
mean?
Yes. However, you need to cover all the units, so
Yeah.
you cannot. Yes, it's not right that you may need to have done one and not that. No, and so the office. I think. Do you have the admin email? The admin email. Do you have it?
The admin what?
The admin email at
Yeah, I
UK
have their
Varsity.
email. Maybe I will send mail to them.
You need to send an email to them. Okay.
All right.
Yes, you
Thank you
need to
so
send an
much.
email. You're welcome. You're welcome. Now, there can't be any research work without recommendations or conclusions. Okay.
Okay.
When you have identified your research topic, you have your aims and objectives, you've done your literature review, you then have what we call your data presentations in terms of what we call your methodology. Presenting your data per what? Pie chart, histogram, data information, you put it out there, you interpreting them. Then when you have done all that, you have to do at least a conclusion recommendation of all that you have gathered. How do you conclude? What are your conclusions? You conclude that this project would go in a long way to solve so, or it will go a long way to, bring this to this and all that. and then you give a further recommendation. Okay, and that's it. So let me read something. It says, conclusion might arise from a comparison between your results and the findings of the studies. They will almost certainly be developed with reference to the aim and objectives of the research. Results are what you have found through research. They are more than just raw data that you have collected. They are the process findings of the work, what you have been analyzing and striving to understand. In total, the results from the picture that you have uncovered through your research. So that's it. Okay, you should be able to draw conclusions, and then you must give recommendations pertaining to what you have discovered per your research. Okay, your research, I've explained severally on this. Your research should be very reliable and it should be very validable. Reliable in the sense that when people pick your research, it should be able to solve issues, should be reliable. And it needs to be validated. Okay. No, reliability means consistency. Okay. Validity means accuracy. Okay. Reliability, people can follow it and they can rely on the proceedings. If it's validated, then means there's accuracy. People can validate it. It's something that really solving something practically, not just anything that was formulated, but it is solving an issue. People can find out about the information that you've written about. It is important to consider reliability and validity when you are creating your research design, planning your methods, and writing up results, especially in quantitative research. Quantitative research. It means quantify, okay? Reliability refers to how consistently a method measures something. If the same result can be consistently achieved by using the same methods under the same circumstances, the measurement is considered reliable. You measure the temperature of a liquid sample several times under identical conditions. Thermometer displays the same temperature every time. It means it is reliable. As oftentimes as you turn a thermometer, you get the same measurement. It is reliable. Okay? When the doctor uses a symptom questionnaire to diagnose a patient with a long-term medical condition, when several doctors use and it does not have the same, it means it's not validable. Okay? Several different doctors use the same questionnaire with the same patient but give different diagnoses. This indicates the questionnaire has low reliability and a measure of condition. It is not reliable. It is not. You check your weight and your weight machine tells you you are 70, and then you check 1 hour time, it tells you you are 80. It is not reliable. Okay? Where validity refers to how accurately a method measures what is intended to measure. If research has high validity, that means it produces results that correspond to raw properties, characteristics, and variations in the physical or social world. High reliability is one indicator that a measurement is valid. If a method is reliable, it probably isn't valid. Okay? If a method is not reliable, it probably isn't valid. If the thermometer shows different temperatures each time, even though you have carefully controlled conditions and ensure the sample's temperature stays the same, it is what? Valid. Okay? But if the symptom questionnaire results in a reliable diagnosis when answered at different times with different doctors, it indicates that it has high validity and a measurement of medical condition. Okay, so one is that thermometer shows different temperatures each time. It is not valid. It's not valid. Okay, it is not valid. Reliability can be estimated by comparing different versions of same measurement. While validity is harder to assess, but it can be estimated by comparing the result to other relevant data or theory. Of course, that's how you say something is valid. Okay, that's why you say something is valid. Okay, so in literature review, what do? Researchers done to devise and improve methods that are reliable and valid. Methodology. How did you plan your research to ensure reliability and validity of measures? Okay, this includes choosing sample set and size, sample preparation, external condition, and measure techniques. Results. If you calculate reliability and validity, state these values alongside your main results. Discussion. This is the moment to talk about how realized and valid your results actually were. They consistent and did they reflect true values? If not, why not? Conclusion. If reliability and validity were a very big problem of your finance, it can be helpful to mention them here. Conclusion. If your reliability and validity were a big problem for your finance, you might be able to, or you should be able to mention them in your conclusion. Okay? So key things is results and discussions. You have to calculate reliability and validity. And in discussion, it is important you talk about reliable and valid results, actually where they were consistent, where there were limitations. You need to state them there. Okay? And then 3D1, that's if you want to score distinction, what do a literature review help in health and social care? And to bring our lectures to one end. Any questions at all?
Well, I would say this research proposal is something that we have to go through over and over again, and being my first time, even doing lecture at all, I would say maybe the recorded version of this should be sent to.
Yes, it is always done. It's
Yeah.
always done.
So if we have the recorded version, then we can as well go back to it. Maybe
It's
by the
always
time
done.
we, might have done with unit 1, 2, 3, 4, then we can go back to the research, the recorded version, and. So because for now, I from 1 to 5, I can't just jump and start doing this now. So let's just have this for record purpose. Then later on, we can go back to it. Yeah,
That's fine. It will be recorded. I'll tell the office to share the recordings. Okay.
it's all right. That's all I can say for now.
All right. I'm most grateful. I'm
Yeah,
most grateful. Do feel free if you need any assistance, do let us know. Okay.
it's all right.
All right. Thanks so much. Thanks so
Yeah.
much.
Thank you.
Bye. Bye. Bye.
Wish.